A blood clot is an accumulation of platelets and/or fibrin that can obstruct blood flow through a blood vessel. Clots are normally formed as a part of the body's natural healing response to prevent excessive bleeding after an injury. However, clots can also form in the absence of an injury and can be life-threatening. If they block blood flow to vital organs such as the heart, brain, or lungs, there are three main steps in the formation of a blood clot. The first step is called vascular injury or damage. This can be caused by a number of factors, including a sudden increase in blood pressure, which can damage the lining of a blood vessel. Foreign objects, such as a piece of debris or atherosclerotic plaques, which are deposits of fat and cholesterol that can rupture and expose the underlying tissue to the bloodstream. And finally, infection, which can cause inflammation and damage to the blood vessels. Once the blood vessel is injured, the second step is the activation of the coagulation cascade. This is a complex series of biochemical reactions that ultimately leads to the conversion of which is a soluble protein found in the blood plasma, into fibrin, which is an insoluble protein that forms a mesh-like structure. This mesh traps platelets and red blood cells, forming a stable blood clot that stops bleeding. The third and final step in clot formation is clot retraction. During this phase, the platelets and fibrin in the clot are pulled together, making the clot more compact and strengthening its connection to the walls of the blood vessel. There are a number of risk factors that can increase the likelihood of clot formation, including a personal or family history of clotting disorders, certain genetic mutations, prolonged immobility, such as being bedridden for an extended period of time, and pregnancy or use of oral contraceptives, which can make the blood more sticky and increase the risk of clotting. Blood clots can cause a number of symptoms depending on their location and size. Some clots cause no symptoms at all, while others can cause pain, swelling, or redness in the affected area. If a clot blocks blood flow to a vital organ, it can cause ischemia, which is a lack of blood supply to the organ. This can lead to tissue death or organ failure if blood flow is not restored. Diagnosing a blood clot can be challenging, especially if it's located in a deep vein where it's not visible. Imaging techniques such as ultrasound, CT, or MRI scans may be used to visualize the blood clot. The treatment of blood clots depends on the location and severity of the clot. Anticoagulant drugs, such as heparin or warfarin, are often used to prevent the clot from growing or spreading. Thrombolytic drugs, such as Alteplase, can be used to dissolve the clot. In some cases, surgery may be necessary to remove the clot. Understanding how blood clots form and what increases the risk of developing them is essential for preventing and treating these potentially life-threatening conditions. By making positive lifestyle changes such as eating a healthy diet, exercising regularly, and maintaining a healthy weight, you can reduce your risk of developing blood clots and keep your blood flowing smoothly.